Hey, and welcome back to the Dana and Josh show. We're going to talk to you a little bit about the Doppler and how to use it most effectively. So this is generally what it looks like. It's in a case like this. Inside you'll find several different things. The first one being the Doppler itself. So we'll pull that out and let's see what that looks like with the standard head on it. So that is the standard head. And the Doppler, which has a dial on the side for power. So you just roll it all the way to the top to get full power so you can hear some noise. The other things that you'll find in here is a different type of Doppler head, which is a flat one, which is we use for other things. That's not something you need to use. So if you were to see this on there, you would probably want to change to the other Doppler head that we just talked about. And then finally, there's some gel, and that's really important to make sure that you use some gel along with the Doppler. So like we said, we turn it on, turn it all the way out, you can hear it, right? And then you take your patient and you find the spot where you want to find a pulse, whether it's on a femoral or on an antecubital or on a radial, wherever you've been asked to look for it. And it's best if you can find it with your own finger first, so you kind of have some sense of where it is. Okay? And the next thing we're going to do is we're going to put a dollop of gel on there, which will help the Doppler as far as noise-wise, so that you won't have as much artifact. And you can kind of hear that whooshing sound, right? That is the sound of a good pulse. If you hear a flapping sound, maybe something that's still pretty good, but if you're doing CPR, you can get that dull sound like that. And the best way to make sure that you get a decent sound is to rock your Doppler back at about 45 degrees. You can kind of hear the difference. You get a nice shrill sound that's pretty obvious to hear. It's as simple as that. I think the things to remember is that you're trying to hear microphone noise from blood flow in this vessel, and this vessel is running horizontal, and if we were to stick this directly straight over the top at 90 degrees, then basically what you're hearing is you're hearing a little tiny passage of blood as it passes past this head, versus when I put it at 45, the blood is actually headed towards the head, and so therefore you get more conduction, and so you'll hear a better noise. So generally what I do is I just try to lock my hand down to wherever I'm at so that it can't move. If you try to do this, you're going to slip because you're in a lot of gel there. So lock your hand down like I have my pinky over here, and feel for, find the noise you're looking for. If you don't find it, then I'll move either left or right and see if I can find it that way. But trying to find it at 90 degrees is going to be a lot harder than if you have the blood flow actually flowing towards the microphone. So that's Doppler in a nutshell. Okay, so next we're going to talk a little bit about LVADs and blood pressures. So the first thing to recognize is from the previous part of the video, most people have a pulsatile sound. It's their heartbeat pushing blood around. Whereas a person with an LVAD, a left ventricular assist device, has got a turbulent flow of blood being moved by a turbulent flow type engine. So what that means is they're flowing blood through their system in a non-pulsatile type action, which means for you, what you're going to hear is you're not going to hear that pulsatile auscultation with the Doppler or with anything else. So first of all, with an LVAD, you're probably not going to find a pulse. You're probably not going to be able to take a blood pressure by just auscultating it with a stethoscope, and those patients require a Doppler in order to be able to take the blood pressure. Secondly, the blood pressure is going to have the sound from the Doppler is going to have a more constant flow versus a pulsatile flow. So you're going to do the same components that you do when you take a normal blood pressure with the Doppler, except for the sound is going to be different. So I think the things to remember here is we're going to put some gel on, we're going to find the sound that we're looking for, and we're going to pump up the blood pressure cuff. The sound will go away, and then we're going to drop the blood pressure like you're trying to get a palped blood pressure with a Doppler, and it will return. And at that point, that number is not the systolic blood pressure, but it's the mean arterial blood pressure. And most people's mean arterial is somewhere between 70 and 90. Most of the LVAD patients sit between 70 and 80. And so just remember that when you get a MAP, a mean arterial pressure of 70, that doesn't mean that's a systolic blood pressure of 70. 70 of a MAP is actually pretty good. Okay, so we're going to put a little bit of gel on. We're going to find our spot. We're going to make sure at a 45-degree angle so that we get the best sound. And I'm going to make sure I'm locked down to his arm with my arm so it doesn't go anywhere. Then we're going to pump it up. You can hear it's gone now, and then we'll let it down until it comes back. There it is right there, and we have a top number. With an LVAD patient, that's just going to be a constant sound that sounds the same. It has that same shrill sound to it, just not pulsatile. We're going to do the exact same mechanics of pumping up the blood pressure cuff with that sound on until it disappears, and then we're going to drop it down, drop our blood pressure cuff down until it reappears, and that is going to be our mean arterial pressure.